Hi, my name is Debbie Komisak. I'm doing a video presentation on the role and function of case management. Roles and function of a case manager in an acute care would entail being a patient advocate, educator, and planner. A hospital could employ a case manager to do utilization review, discharge planning, resource management, coordination of various team members in the hospital. She could take care of that. Depending on the complexity of the individual patient, this could include coordinating respiratory therapy, speech, PT, OT, physicians, and home care nursing and respiratory companies for the complex patient, which would be very advantageous to have one person collaborate all of those team members. The hospital nurse would be a much needed team member for coordinating all that care. It would need to start near admission, and she'd follow throughout the stay to discharge. In a home care, a nurse, case manager, is also an advocate for the patient, acting as a liaison for the patient to the insurance payer by getting required information for authorization for home care for nurses. She would be responsible for that. She will act as an educator for patient and families. She will oversee the staff in the home that cares for the patient, and she will provide regular education and supervision to those nurses that work in the home to make sure they're being compliant. Home care manager is also responsible for the upkeep of the patient's care plan, adding orders or changing them, adding treatments when needed, so to keep the care for the patient current and make sure that it is in compliance with regulations. She will also do regular visits in the home to these patients to assess them. In a primary care center, the case manager's role would be primarily focused to oversee wellness programs, screenings, triage phone calls to assist patients to see if they need to be seen by their physician or if they can have advice to do self-care. They can coordinate referrals to community-based resources and make sure patients are knowledgeable and compliant with their treatment for their current illness or condition. The skills of a community health nurse would be to need to do a community health plan for a patient, would be knowledge about the diseases, their signs and symptoms, and treatments of patients they care for in the community. They need to be aware of community resources such as clinics, social services, or senior centers, so they can refer the patient to them and keep current with any new resources being opened in their community. They also need to be good at education for the patient, so the patient could better care for him or herself. Approaches a case manager would need to use to promote the highest quality of care and careful use of resources would be to have the nurses knowledgeable of payer resources and what allowances are given to the patient. That way, especially for home care, she can find DMEs that accept their insurance, search for DME suppliers that gives the most supplies for their money. She needs to be current with the insurance company and clinical treatments of various disease process so she can give the best treatment for the patient. She needs to be involved in her community resources, visit the resources in the clinic or senior center, and get to know the leadership there on a personal level. And this will help the community nurse to know what is available to her patients.